Hello, my name is Dr. Richard Randle. I'm a beef extension veterinarian with the University of Nebraska in Lincoln. This presentation considers issues surrounding calving management and dealing with cows suffering calving difficulty. Calving difficulty, or dystocia, has a significant impact on the cattle industry. There are the obvious losses associated with calves or cows that die at or soon after calving as a direct effect of dystocia. There are also less obvious losses due to the delayed rebreeding of cows that suffer dystocia, failure to rebreed resulting in more open females, extended calving seasons with more variation in calves, and increased labor. A Nebraska study estimated that losses could reach as much as $25 million in this state alone. A national survey reviewed factors that reduced the calf crop. Cows that fail to become pregnant account for 17.4% of the reduction. Of cows that do become pregnant, about 2.3% lose the calf during pregnancy. Calves that are born dead or die within 24 hours of birth account for about 6.5%, while 3% of calves from 1 day of age to weaning die. As you can see, almost 70% of the calves lost from birth to weaning are born dead or die within the first 24 hours. Most of these losses are related to calving difficulty. Studies at the Meat Animal Research Center in Clay Center, Nebraska show that calves experiencing dystocia are 4 times more likely to be born dead or die within 24 hours of birth. This occurs for a variety of reasons. The longer the calving process takes, the more likely the calf will suffer hypoxia or oxygen deprivation and associated metabolic changes. These calves will be born with less vigor and less ability to combat stresses such as cold. They are slower to stand, slower to suckle, and typically suffer from inadequate colostral intake. Calving difficulty also has an impact on the cow's ability to return to estrus and rebreed. This study evaluated reproductive performance on a 45-day AI breeding period, followed by cleanup bulls. At the end of the 45-day AI period, 15% more of the cows that experienced dystocia in the previous calving season failed to rebreed, compared to cows that had a normal calving, and that difference was maintained at the end of the cleanup period. Services per conception were similar for the two groups, indicating that a delayed return to estrus resulted in the difference. Numerous studies have been conducted looking at various factors related to calving difficulty and ways to combat these factors, such as the use of EPDs in sire selection, nutritional status of cows, and proper development of replacement heifers. However, a significant proportion in the incidence and severity of calving problems remains unexplained. Ultimately, this means that at some point we have to contend with the cow that is having a problem calving. The objectives of this presentation is to review the process of normal calving, how to recognize when there is a potential problem and if assistance is needed, determine what type of assistance is needed and when to get help from your veterinarian. The overall goal is to reduce post-calving problems in cows and to save calves. The process of labor can be divided into 3 stages. Stage 1 is from the point of initiation of labor until the cervix is fully dilated. Stage 2 is the actual delivery of the calf, and Stage 3 is the delivery of the tissues and fluids associated with pregnancy. Although times can vary, Stage 1 of labor lasts an average of 4 to 6 hours in heifers and 2 to 3 hours in cows. Often, Stage 1 is observed in heifers but may go unnoticed in cows. The list on the left describes what is occurring inside the animal, while the list on the right describes what we observe. For 9 months, the calf resides in a large fluid-filled sac. As labor begins, the calf rotates into position for delivery. Weak coordinated uterine contractions begin and forces the calf against the cervix. As pressure increases on the cervix, it begins to relax and dilate. This process continues in waves under hormonal influence. We observe the animal in stage 1 as being nervous, kicking at her side, lying down and standing up, and some evidence of slight straining. The animal may move away from the herd. This stage continues until the cervix is fully dilated. Once the cervix is fully dilated, stage 2 is initiated. The calf enters the birth canal. There are strong coordinated uterine contractions, and the feet and head protrude first. This stage continues until the delivery of the calf is complete. We observe the cow in obvious labor. She exhibits strong frequent straining while lying down. Evidence of the water sac and/or calf is visible. The water sac may rupture with a discharge of fluids. Again, times can vary, but on average, stage 2 of labor lasts 1 to 3 hours in heifers and 1 to 2 hours in cows. Stage 3 of labor constitutes the delivery of the placenta and fluids of pregnancy. It generally lasts 2 to 8 hours in both heifers and cows. Understanding the normal birthing process helps us to recognize if there is a potential problem. Once an animal is observed in stage 2 of labor, it should not last longer than 2 hours. One way to evaluate the process is to watch for continual progress. If there has been no change in a 30-minute period, then that should be a signal that it is time to examine the animal. In preparing for examination, take precautions to properly restrain the animal, both for its protection and yours. Wash the rear end of the animal with soap and water and restrain the tail. Remember that with the cervix dilated, the reproductive tract is exposed to the outside environment and will always become contaminated to some degree. It is important to minimize the amount of dirt and fecal material that is introduced during examination. Wear OB sleeves for protection, and be sure to lubricate hands and arms generously to prevent irritating the sensitive tissues of the reproductive tract. Typical equipment needed to examine and assist a cow are listed here. It is advantageous to have more than one OB chain or strap, as we will describe later. One thing to remember is that soap is for cleaning and lubricant is for lubricating. Using soap as a lubricant can result in breaking down the mucus, the natural lubricant produced by the animal, and ultimately cause severe irritation to the tissue. Having a calving area is important to properly restrain the animal and to provide shelter in inclement weather. If you are rushing the process because it is cold, raining, or snowing, it is more likely that you don't pay attention to details and can cause injury to the calf and/or the cow. If you have made the determination that the animal needs to be examined, then it becomes important to have a plan of action. The primary objective of examination is to gather information. The examination should always be performed the same way every time so not to miss details. During the examination, 3 questions need to be addressed. Is the cervix fully dilated? Is the calf in the proper position? And can the calf pass through the pelvis? A successful examination should result in one of these outcomes. First, I don't know what the problem is. Second, I know what the problem is, but I know that I can't handle it. Or third, I know what the problem is, and I know how to handle it, but I am unsuccessful in correcting it within a 30-minute time period. Then the next step becomes clear, and that is to get help. How do we determine if the cervix is fully dilated? The cervix is a muscular band of tissue that remains tightly contracted to protect the uterus from the outside environment. It relaxes during stage 1 of labor to the point where the uterus and the vaginal vault become one continuous canal. Attempts to extract the calf through the cervix before it is fully dilated can result in injury to the calf from excessive strain and injury to the cervix, such as tearing, resulting in post-calving problems for the cow. As you move forward along the vaginal wall during examination, any ridge, hump, or band of hard tissue is probably cervix and means it is not fully dilated. If the cervix is fully dilated, it is unlikely to feel it at all. Is the calf in the normal position? Depicted on your left is the normal head-first presentation with the calf upright, front legs extended, and the head lying between them. Depicted on your right is a normal backwards presentation. It is possible that a cow with a backwards presentation can deliver the calf unassisted. However, a backwards presentation presents problems. Notice the umbilical cord that supplies oxygen to the calf until it is born. During the birthing process, the umbilical cord at some point is trapped between the belly of the calf and the bony pelvis, which can shut off oxygen to the calf. In the head-first presentation, the front half of the calf is exteriorized by the time it happens, and it can begin breathing on its own. If the calf is backwards, the head is still submerged in fluid. Therefore, delivery of a backward calf must occur more rapidly to prevent the calf from drowning. We can use the calf's feet as an indicator of the position and presentation. In the head-first presentation, the bottom of the calf's feet are directed toward the ground, whereas in the backwards presentation, the bottom of the calf's feet are pointed toward the sky. Usually, this is an accurate indication of the calf's position, but on occasion it could be misleading. For example, what if the calf were backwards and upside down? The definitive way to determine if a leg is a front or back leg is to examine the first two joints up from the foot. If the two joints bend in the same direction, it is a front leg, that is the fetlock and carpus or knee. If the two joints bend in opposite directions, it is a back leg, that is the fetlock and the hock. The third question, can the calf pass through the pelvis, is more difficult to answer. One method devised to try and answer this question is termed the 3 tests for delivery. The first test involves placing simultaneous traction or pulling on both front legs at the same time. It is best to place an OB chain on each leg and pull together. The first test is successful if the entire head, including the pole, enters the bony pelvic canal. If the first test is successful, proceed to the second test. Pull on one of the two legs. The fetlock joint should protrude past the vulva of the cow the width of your hand. If the second test is successful, then pull on the opposing leg while keeping the first leg extended. The opposing leg should also protrude past the vulva of the cow the width of your hand. If all 3 tests are successful, this is a good indication that failure of any of the 3 tests results in failure period and indicates a possible problem with the calf successfully passing through the pelvic canal without some difficulty. If you proceed to assist the delivery of the calf, it is important to remember that there are 2 potential obstacles to overcome. They are the shoulders and the hips. As you begin to pull, it is preferable to use an independent chain on each leg to allow for 2-point traction. This means that you can pull each leg individually as needed. If you experience binding of the shoulders, it is possible to walk the shoulders through the pelvic canal by pulling one leg forward, then the other, then the first leg again, in a ratcheting motion. As extractive forces are applied to the calf, keep in mind what is described as the natural arc of birth. Depicted here is the pelvis of the cow. You can see that the opening is oval in shape. This is what the opening would look like if the pelvis was perpendicular in the cow. However, as you can see here, the pelvis is not perpendicular, but is angled forward about 30 to 40 degrees. By pulling the calf up into the pelvic canal, then outward and back, and down toward the ground in an arc, we can keep the calf in better alignment with the angle of the pelvis and minimize binding. Anytime you are applying extraction, use the minimum amount of force needed. An average adult male typically can exert about 300 foot-pounds of force, whereas mechanical pullers can exert 3,000 to 5,000 pounds of force. Used too aggressively or inappropriately, mechanical pullers can cause severe damage to the calf and/or the cow. Remember to coordinate efforts to pull the calf with the contractions of the cow. Pull when the cow is straining in contraction, and rest when she rests. The last obstacle that can present a problem is hip lock. On the left is the pelvis of the cow, and on the right is a cross-section of the calf at the level of its hips. Hip lock occurs when the hips of the calf are too wide to pass through the pelvis. Once the hips of the calf engage the cow's pelvis, it can be very difficult to break this lock. The way to avoid hip lock is to rotate the calf 90 to 180 degrees once the head and shoulders have been delivered. The attempt is to rotate the calf's hips so that they line up with the widest dimension of the cow's pelvis. About 5% of calves are in an abnormal position at birth. Common examples include one or both front legs turned back. This is an example of the head turned back, and this depicts a breech birth. Each case presents a different situation that must be evaluated. The key to remember is that the abnormal presentation must be corrected and the calf manipulated into a normal presentation before it can be delivered. If faced with an abnormal presentation and it has not been corrected within 15 minutes, you should consider seeking help from your veterinarian. To summarize, here are some general guidelines. Don't interfere too soon. Observe closely for the onset of stage 2 of labor, then watch for continual progress. If assisting, use the minimum amount of force necessary. At any point, if you are unsure, then you should call your veterinarian.